Hi, my name is Josh Greenspoon. I'm a total joint surgeon at Coastal Orthopedics, specializing in hip and knee replacements. So I was exposed to orthopedics at a really young age. My dad was an orthopedic surgeon who practiced in Melbourne, Florida for about 35 years. Growing up as a young kid, I would always go around with him on his patients on the weekend at the hospital. Going through high school, I spent a lot of time in the operating room with him, and that piqued my interest in surgery in particular. And then once I got into medical school, my dad was interesting. He never put a lot of pressure on us to go into medicine. However, once I got into medical school, he was very happy that I chose that path. And when I said I wanted to be an orthopedic surgeon, he was very, very happy. When I got into medical school, I knew I wanted to do surgery, but wasn't 100% set on what field yet. But once I spent some time in the operating room with the orthopedic residents at University of Miami, I knew that's what I wanted to do with my career. My education and training, I went to McGill University in Montreal, Canada for undergraduate, for college. I then went to University of Miami for medical school, which was a great experience. I then was fortunate enough to get into residency in orthopedic surgery at Rush University in Chicago and train with some of the world leaders in orthopedic surgery. And I was fortunate to stay on for my adult reconstruction fellowship, specializing in minimally invasive hip and knee surgeries as well as complex revision procedures at Rush University. I chose to go into total joint surgery because for me, there's nothing more gratifying than having a patient who is limited due to pain and arthritis, and you have a great surgical technique such as a total hip replacement or total knee replacement, which allow them to get back to doing all the activities they like to do pretty quickly, I might add. So that really inspired me to go into this field. I think it's the best subspecialty of orthopedic surgery. Revision hip and knee surgery is really interesting to me because you have a patient who is expecting to have a great recovery after a primary total joint procedure, and sometimes complications do happen, whether it be infection, instability, or just persistent pain after surgery. Revision surgery provides a really challenging diagnostic dilemma for the treating doctor, which I enjoy, as you have to figure out what's causing the symptoms and what are causing the issues, and then you have to try to identify ways to fix that and improve the patient's clinical picture. So that challenge is interesting to me, and I enjoy helping patients get back to doing the things they want to do. I chose Coastal Orthopedics for a few reasons. Number one, after living in Chicago for 6 years with my wife, and we started a family there with 2 young boys. We were from Florida. My wife absolutely wanted to go back to Florida. I interviewed at a lot of groups all over the state, and what really attracted me to Coastal was, number one, the amazing location in the Bradenton, Sarasota area. The group really impressed me with the culture of patient-centered care and really their commitment to the community. In addition, I really liked the camaraderie between the senior partners, and I was looking for a place where, as a junior surgeon, I'd have some mentorship with the senior partners here, and they were very welcoming and willing to help me and guide me through my career. I'm really looking forward to my career at Coastal Orthopedics. This is a rapidly growing part of Florida, and I'm excited to be part of Coastal Orthopedics' outreach into the community and help take care of the patients in the community that we serve.